PSA, or prostate specific antigen, is an important biomarker used for screening for prostate cancer. Remember, the prostate is a glandular organ, meaning that its job is to secrete fluids. Most of the fluid portion of the semen is produced by the seminal vesicle right here, and that seminal fluid will travel through the ejaculatory duct right here and then meet up with the urethra within the prostate. Of course, during ejaculation, that semen will travel out from the prostate through the urethra where it is then expelled. Now this is where PSA comes in. PSA is produced by luminal epithelial cells within the prostate. The job of PSA is to liquefy the semen by its action on these jelly-forming proteins that are found in the semen called seminogelin and fibronectin. So the tricky thing to understand here is that PSA in and of itself isn't really bad. It's a protease that's normally produced by the prostate, and it helps maintain the normal consistency of seminal fluid. Under normal circumstances, some of this PSA can leak into the blood, and that's why we can test for PSA within the serum or the blood. Now let's say we have a cancerous tumor within the prostate. What this tumor is now doing is it's locally expanding and invading and destroying the local structure and architecture of the prostate. What this will do is it will compromise the normal basal layers and basement membranes of the prostate. Loss of these natural barriers will result in PSA leaking out of the prostate into local blood vessels and escaping into circulation. That's why prostate cancer can cause elevated PSA levels in the blood. But this is where it gets really tricky. There are things other than prostate cancer which can also cause elevated PSA in the blood. For instance, benign prostate hyperplasia, which is simple enlargement of the prostate and is seen in a lot of older men, is a common non-serious condition that can cause elevated PSA levels, especially in many older men. Bacterial infection of the prostate or prostatitis, as well as a digital rectal exam or prostate needle biopsy, or really anything manipulating or causing irritation to the prostate, can transiently cause increases in PSA levels too. This is why PSA levels are kind of controversial for screening of prostate cancer, because many other things that are not very serious can also cause elevations in PSA and cause false alarms. This is why the American Urologic Association recommends that PSA levels be interpreted by the physician in the context of the whole entire clinical picture of the patient. Generally speaking, high PSA values or acute increases in a short period of time generally warrant further evaluation.